Let us look at this. This is a diagram showing a vein. Most people don't realize it, but veins have tiny valves inside them which allow the blood to flow in only one direction, as shown by these arrows. Now, in other words, the blood can only flow towards the heart. It cannot flow away from the heart because the valves will prevent backflow. Now, every time the muscles, these drawings here represent muscles, contract, as shown on this drawing here, this rather rough schematic, every time that the muscles contract, they will compress the vein, and since the blood cannot go back down because its backflow is prevented by the valves, it can only move upwards. Therefore, the muscles play a very, very important part in stimulating circulation. Every time the muscles contract, they pump blood forcibly towards the heart again. So in other words, the heart pumps the blood away towards the extremities, and the muscles are responsible for pumping the blood back towards the heart. Now, here's the last of these schematics, and it demonstrates the situation which arises when extreme swelling takes place. If a vein becomes engorged with blood and extremely stretched and swollen, the valves become ineffective. They simply cannot reach across. And now the blood, instead of flowing in only one direction, will flow back and forth and begin to stagnate and harden. Blood, or swelling if you like, will then become organized and hardened and will form massive adhesions, which may make it impossible for the horse's tendons and ligaments to ever become functional again, therefore making a resumption of racing or work out of the question. So therefore, now you have to clearly understand what happens. The original injury is usually, in the majority of cases, of very little significance. The real damage is done is caused not by the original injury, but by the stagnation of blood due to poor circulation. Therefore, the first and most important thing that you have to do to get the horse back to normal is to use every possible means to stimulate circulation. That is if you can successfully do that, you will heal the horse so effectively that all signs of injury will very rapidly disappear, and your horses will be absolutely as good as new, often after as little as 1 month or maybe 2 months, even if the injury is quite severe. Now, we have said that by far the most important thing is to keep the circulation going. On no account must the blood and the swelling be allowed to organize and become solidify and form adhesions. There are 5 ways basically in which you can stimulate the circulation. First of all, by doing what we are showing here, by placing the horse's leg in ice. Now, to do this, I'm sure you have already done it about 1,000 times or more, or 10,000 times, so you probably are not too interested in what I'm showing here, but nevertheless I will go through the motions just in case there are listeners who have never iced the horse's leg. Anyhow, what you do is you fill the bucket with water to about halfway up, and then put the horse's leg inside, as we've done here. Then you put a bag of ice in, and keep the horse's leg inside, and do whatever you can to prevent the horse from lifting his leg and pulling it out. Now, the assistant is trying to keep the horse calm. Now, what effect does the ice have on the swelling? The ice has a powerful constrictive effect on the tissues. The tissues constrict, tighten up, and push the swelling out. Therefore, the ice plays an important part in preventing swelling, in maintaining normal circulation, And initially, the most important thing it does is it prevents the blood, the bleeding. Therefore, if the ice is applied soon enough after the injury, the bleeding can be reduced to such an extent that the adhesions which could be caused by the blood seeping in between the tissues, as we showed on that diagram, can be entirely prevented. The ice application is important in the first day or two, maybe 3 or 4 days, but after that it becomes less important. But initially, if possible, if you have the manpower and so on, and if you really care about the horse, you can ice the horse's leg as often as every hour on the hour, for say 5 minutes, or maybe a maximum of 10 minutes. I don't think it is necessary usually to ice a horse's leg for longer than that. Now, the second important way of trying to maintain normal circulation and prevent stagnation of the swelling and hardening of the swelling and formation of adhesions is bandaging the horse. A horse with an injured leg or injured tendon or ligament and so on should be kept in bandages absolutely all the time. They should never ever be taken off, either during rest in the stall or during exercise. Now, the next very important way of trying to prevent adhesions, prevent stagnation of the swelling, and trying to promote normal circulation is to lift the horse's leg up, as shown here, as I'm doing here, and gently take the tendon or ligament between your fingers and gently massage the swelling up towards the heart. This has two effects. First of all, it will move the swelling, prevent it from hardening, and secondly, almost as important, it will prevent the formation of adhesions. It will prevent the blood and the lymph and the swelling from hardening and becoming organized and gluing the tissues together. This should be done, or can be done, as often as once every hour. If you really care for your horse and you want him to get well quickly for you, you can do this every hour, once an hour, gently, not to irritate the horse. And then you can put in this picture, I am putting on some polo wraps. I have found Canterbury polo wraps to be by far the most effective. They are the bulkiest, widest, and give the best support. And the horse is being prepared for exercise.